And my name is Ene Indermitte, and I'm coming from another university in Tartu. And actually, this is the oldest university in Estonia and also in Europe. So it was founded in 1632. So really old university, a classical university. As you see from the title of my presentation, this is completely off topic regarding your summer school. But we were discussing with Marek that maybe it's a good idea to introduce other people from our Estonian Water Association. There are other people who are not only dealing with natural waters, but there are people who are interested in health issues. And there is at least one thing common with your topic and my research interest is water. But it's drinking water, and I'm very shortly presenting you some of the research we have been doing in our university. Some of these are connected with my PhD studies years ago, but we are still following this topic because this is very important one. And and this is also a topic you all relate to because we are exposed to drinking water every day. And usually what people think that, okay, rivers may be polluted and oceans may be polluted, but the tap water or the bottled water I'm drinking, this is relatively safe. This is the water molecule I'm using every day. But actually, this is not so. So this drinking water contains a lot of different chemicals. This can be naturally occurring or due to pollution. And we should keep in mind that daily we consume about 1 or up to 2 liters per day. So it means, and this is a daily exposure, this is a lifetime exposure. And it means that also the milligrams or even the micrograms of some pollutants can have some serious health effect now or in the future. So not even after 1 month or 2 months, but maybe after 10 years of consuming. And also this consuming of water depends on age and our physical activity and also the climate, of course. The more warmer the climate, the more we consume. And in every country, to prevent negative effects of drinking water, we have set our own limit values, so every country has. And what I should also mention that while we are very well recognizing the infectious part of the drinking water, so there are certain kind of infectious diseases that are spread by drinking water, and we are very well aware, and we boil the water. We want it to be safe. Then some chemical risks or these long-term effects from drinking water are very often underestimated or overlooked by people or by countries or by authorities. But now to the topic. So this is fluoride in drinking water. I have a question for you. It depends on the dose, yes. So the fluoride is an element has not only a positive effect, but it has also a negative effect. So we consider fluoride in drinking water as a very important health determinant because it has two sides. So if we have deficiency of fluoride in drinking water, we may develop caries more easily. And that's why we are adding fluoride into our dental products. Dentists are offering us fluoride tablets and so on. But on the other side, what is a relatively new understanding or knowledge is that there are also negative effects from the excess of fluorides from drinking water, and mainly and primarily we see the first signs of toxic effects of fluorides if we develop dental or skeletal fluorosis. And I will tell you more about what other health effects. And what is important in fluoride, so most of the micronutrients we get from food. So for the fluoride, drinking water is the main source for humans. So we get most of our daily dose from drinking water. And it depends from the country and the climate and the person. So it may end up to 90% of total daily intake. All right. So it is very important. And of course, there are other sources, but they are much less important. So these are some kind of food, for example, seafood, fish, some marine food. And of course, for children, it is very important if we ingest or if we try to, some children like to eat dental toothpaste, which is good for children. They think they kind of a candy. So this can be also an important source. And that's why most of the countries have set a limit value for 1.5 milligram per liter. If you look around the world, then you see that the United States have 4 milligrams per liter, and so they have their own reasons. But as you know, some of the countries fluoridate very fluoride-poor drinking water sources. And it is recommended by WHO that if we fluoridate the water, it shouldn't be over 1.0. If we look at the water resources, then globally we see that high levels of fluoride found in different water sources might be a limiting factor for providing the population a safe drinking water. Maybe some of you don't know what is a dental fluorosis, so I show you the picture. So typically we have 4 categories, so starting from very mild, you can see here, mild to moderate to severe, and the severe fluorosis can sometimes end up with a loss of teeth. So the fluoride will make the enamel density very tight, so and it is very prone to destroying himself if we are eating. So it's not good if it is the concentration is very high. And of course, the very serious effects of excess fluoride intake is skeletal fluorosis. Luckily, we don't see it in Estonia, but there are countries in the world that is an endemic disease, and this is a crippling disease. And also this dental fluorosis, you can't do anything. Once you have developed it, nothing can be done. Of course, some dental restoration can be done, but it is not curable. So that's why, and it affects also the quality of life. It's not even if it's in a mild form, we can't smile very openly because our smile is maybe not so nice. About research. 20 years now, we also, as a scientist, we know that there are also other effects than effects on the heart tissues. So here are some a table where you can see that there are studies that have been looking for the influences on pineal gland, thyroid. We see there is some neurotoxicity studies. And also for the adults, what we see that they are more prone to bone fracture, hip fracture in elderly, causing osteosarcoma, and so on. And if you see what is the lowest observed adverse effect level in these studies, so the WHO limit value is 1.5, but some of the studies show that it might be good to consume less fluorides in our daily drinking water. So this is quite a serious issue. There are also known many endemic areas in the world. So there might be the pollution of water with fluoride, but also soil. And so then it comes to tea leaves, it comes to rice, ends up in rice. And so when we are consuming the rice, we might also get excess dose. And so there are these countries are around Asia, Africa, Middle East, and also in Estonia, we have some regions where fluorosis is endemic. So this is like naturally occurring disease and naturally occurring pollution. About the methodology, we have been looking for fluoride health effects among the Estonian population around 20, 30 years now. And we are using this risk assessment concept. We are all using, and we want to protect the population from long-term adverse health effects from any environmental risk factors. And typically we have 4 stages of risk assessment. And what is important, this health risk assessment, we combine the evidence from several studies. So this is the health risk assessment is not complete if we are missing exposure data or if we are missing, for example, dose response data. And that's what we are trying to do is that Estonia have the complete picture in all these different steps of health risk assessment. But this is a scheme of risk assessment for 4 stages. Of course, this is followed by risk management and risk communication. And here you can see what kind of research is needed. For example, in hazard identification, we would like to know, is there really fluoride present in our water works? Is it ends up in our drinking water and are we exposed to it? So, and where is it in Estonia? Is it all over or is it in certain places and so on? Then we want to know in those responses assessment how severe cases we have, how many cases we are developing. So we can use toxicological studies, in animal studies, but the most valuable studies are epidemiological studies where we can see among different local populations, for example, in Estonia, under our own climatic conditions and so on. So these are very valuable. And in red here, so you can see here what type of studies we have been doing. So we have a complete picture currently about this fluoride issue. And I'm showing you some of the results. The study area, of course, Estonia is a small country, so we were able to study all over the Estonia. And these black dots here are marking the public water supplies that are serving at least 100 persons. So public water supply. And we were visiting all these public water supplies and taking the water samples and making also the fluoride analysis. The population of Estonia is 1.3 million. The total area is about 45 square kilometers. And we have 15 counties. But what makes the studies in drinking water very complicated, we don't have only 1, 3, or 10 public water works. We have so many, we have over 1,000. And most of them, or over 80% are those that are serving less than 500 people. So some of these public water supply systems, they never knew what was the fluoride concentration in their wells or in that type of water. So this was really at that time a very new information and very necessary for stomatologists, for example. For the geological part, what is important to understand in Estonia that we are in a very good or lucky position that, as we said, you can drink tap water everywhere or most of the parts in Estonia because we are using groundwater sources from 5 different aquifers, and they are clean with a good quality. Of course, there are some differences, and this is also a scheme here. You can see from the north and from the south. So, and it depends where you are in Estonia. So there are different layers of available. So that, for example, we are in Tartu, we can use several wells from different aquifers, and then you should know which is fluoride, which one is not. The other part of Estonia, there are 2 towns only that are using the surface water, and you know the surface water has their own disadvantages or limitations because you have to purify this water. This is used in capital Tallinn and in Narva. And usually the fluoride content in surface water is very low in Estonia, but not all over the world. So some of the other parts of the world can be polluted, but in Estonia it's very low. But in some aquifers in Estonia, the fluoride content can be very high. So we made a fluoride study as I said, and we also make a follow-up because actually this is over the limit values. We are not compliant with European Union regulations, and this situation actually is not allowed. So we should do something, and if it is not possible to do, then we have to warn the population so they can have alternative water sources and so on. So there are some kind of information about what methods we were using and so on. And then we were doing this sampling. So this is a kind of methodology part. And another important dose response study we did in Tartu, town we are at the moment. Years ago, we had a very interesting situation. Different regions of Tartu wells gave drinking water with very different fluoride levels. So it meant that we were able to study 12-year-old school children who had already developed permanent teeth, that we could see the fluorosis signs, and only children reporting the continuous residency in selected districts were included. And then we could see what is the prevalence of disease in different regions with different fluoride content. So this was the dose response study. And then for the step 3 exposure assessment, we were then linking the databases from our fluoride studies from tap water levels. And then we were using database from Health Protection Inspectorate. So we know exactly how many people who are using a certain well water. And we also developed this exposure category. So the low fluoride drinking water, it means below 1.5 milligrams, it is sufficient to prevent caries, but this is safe to drink. So you must understand this is safe to drink, but dental stomatologists should know. But what is most important, we need to know what happens with these people who are drinking with very high fluoride content. So the results, what you see here, so we discovered, and also some, it was very new information, that the 14% of the water samples from tap water are using the water actually, which is toxic. So you could call as a media news. But most of the drinking water was then optimal level or low level. So we should deal with this red part. And this is not evenly distributed, but and in the map of Estonia, we can see that this high level, fluoride level drinking water is mainly found in taps in Western Estonia, in islands, but also in South Estonia. We have mostly very low fluoride levels, but we have wells and small towns that were at that time using very high fluoride levels. And this is a very interesting result of dose response relationship. So these are different districts of Tartu. You see the water samples, you mean the mean, and then you'll see also what is the prevalence of dental fluorosis diagnosed, and you see very nice relationship that the lower the fluoride level, the dental fluorosis percentages, the prevalence is very low, but in Tartu and Veerik is very high. And don't be worried very much as a result of our studies. Of course, all the water was tried to switch off these wells or mix the water or do something. So this situation doesn't exist anymore. But the exposure has already happened. So children who have been living 12 years, they are living with this fluorosis with all of the life. So this is the result. So you see here a very nice correlation of, here is also not only our Tartu data, but some previous data from other regions of Estonia, so pooled data, but still a very nice correlation. So we could see that we have our own local data about the Estonian. And then about this risk. So what is the risk of developing the disease? So people very often want to know. So we were comparing all the high-level fluorides with so-called normal, the risk of developing the disease. And then we see that the prevalence of dental fluorosis, even if it is a small amount over the limit value, still there is a 4.4 times higher possibility to develop dental fluorosis. And you see there are some regions in Estonia where this is very high, and then almost the risk is very high. So this was a serious problem. And also what the stomatologists wanted to see, they wanted to know is if the people they are treating, where these people are who are at risk. And then we were offering them this data that here in this county, in this village, you have to do this. And also in preventive cardiacs, for example, in South Estonia, where the levels of fluoride are very low, you should also know this, that this is very, very low. So we have very good data to offer for the practitioners as well. To finish my talk, what is some future research, we know and we also studied that we see also a very good correlation that the waters that are rich in fluoride usually, very often, are very rich in boron as well. So boron is also limited in drinking water, and it has their own health effects, mainly in male reproductive system, affecting the spermatogenesis. And so there is a future possibility to study also the risk of to the reproductive system as well. So this is summary. Maybe what I should say that due to this long-term research and the efforts from public waterworks, we have diminished the number of public water supplies that are giving high fluoride drinking water. I think there are only 6 water supply systems that are still giving this high fluoride water. So there has been a lot of use from this research. And the last slide is that we are applying the health risk assessment methodology not only in drinking water studies. Of course, we have done, for example, in Narva, we used to have a problem with chlorination byproducts. So actually, we were counting the excess cancer cases annually that are expected if the bad situation is continuing. Luckily, the town Narva has now a new water treatment plant, and we don't have this problem anymore. But then again, my newer research is dealing with also health risks from air pollution in major towns in Estonia, and also health risks from heat waves, mainly general mortality and morbidity. Yeah, this is my last slide.